All right. Welcome on behalf of Plano Public Library. We are happy to have you here today. This is Medicare 101, and Mary Jane Frank is here with us from the Area Agency on Aging. And she has a presentation for you and will definitely answer questions for you as well today. Thanks for coming. Your microphone is muted. Later on, when we have a chance to ask questions, you can use the Q&A button or chat for questions, Q&A for technical questions if you're having trouble with audio or another problem. You're welcome to type your question in there, and then you can use chat for any questions of Mary Jane in her presentation, and there will be an opportunity to ask those questions following her presentation. So it's my pleasure to present Mary Jane Frank. She has been with the Area Agency on Aging for about 10 years. She is a benefits specialist, and she has been involved with the Medicare benefits for quite some time and has great information to share with you. Mary Jane, thanks so much for your time today, and go ahead.
Okay, give me a second here. And let me get the screen. All right, hopefully everybody can see the screen, Medicare 101. I'd like to welcome everyone today, and I want to thank the tech-savvy Plano Library staff for helping with this Zoom presentation. I surely could not do it without you all, so really appreciate it. I just want to talk a little bit about our agency before we get started. I'm from the Area Agency on Aging of North Central Texas. So there are 28 area agencies on aging in Texas, and there is an area agency on aging that exists in every county in the United States. So we all have similar programs, and we all the area agencies on aging provide benefits counseling. So we are an intergovernmental nonprofit, so our services are free. So that makes it nice. And I'll have my contact information on the last slide of the presentation. So if you need to contact me with any questions, maybe you don't want to, there are personal situations going on with you and you don't want to ask it today on the presentation, then you can for sure call me and we can talk about it over the phone, or you can contact me by my email address. So let's get started. And okay, so what is Medicare? So Medicare is a health insurance for people that are 65 and older. They're also for people that are on disability. So if you've been on disability for 2 years, you automatically become eligible for Medicare. There are certain disabilities that you will access Medicare before the 2 years, and that's if you're diagnosed with ALS, then you will be eligible for Medicare without a waiting period. Or if you're diagnosed with kidney disease, end-stage renal disease, where you have to go through kidney dialysis, then there's just a short waiting period to become eligible for Medicare. And to get Medicare, you've got to be a U.S. citizen or lawfully present in the United States and reside in the United States for a continuous 5 years. So how do you enroll in Medicare? Well, depending on how your work history or who you paid into your work history depends on how you enroll in Medicare. So if you worked a job where you paid into Social Security, the FICA taxes, then to enroll in Medicare, you would contact Social Security. If you worked for the railroad, you would contact the Railroad Retirement Board and they would enroll you in Medicare. Or if you were a federal retiree, you would contact the Office of Personnel Management to enroll in Medicare. So the reason why you would contact those agencies, because they're the ones that look at your work history and see that you've paid into Medicare and to see if you are eligible for it. Then once you enroll in Medicare, then on the right, CMS, which stands for Centers for Medicare and Medicaid Services, they would handle the rest. So either if you're an original Medicare or a Medicare Advantage plan, then they would be the ones that you would contact for your Medicare benefits. So when we talk about Medicare, there's 4 parts of Medicare: Part A, Part B, Part C, and Part D. So when we talk about original Medicare, that's just Part A and Part B. Part A is your hospitalization. Part B is your doctor's visits, outpatient services, MRIs, x-rays. Part C is optional. Those are the Medicare Advantage plans, and they have the health and the drug plan embedded together in one package, so you don't have to get a standalone drug plan. If you choose to stay with original Medicare and not go with the Medicare Advantage plan, then you're going to have to access Medicare Part D, which is the prescription drug coverage, and you'll have to get a Part D drug coverage plan to get for any prescriptions that you have filled at the pharmacy. So you have a couple of choices when you become eligible for Medicare. On the left, you can stay with original Medicare with your A and B. Then you'll need to add a drug plan to cover your prescriptions that you get filled at the pharmacy. And then it's optional that you can get a Medicare supplement insurance, also known as a Medigap, that will fill in the gap or supplement what Medicare does not pay. And we're going to look at that. Medicare doesn't cover everything. So that's why you would want to consider getting a Medigap or a supplement insurance. That's your one choice on the left-hand side. On the right-hand side, you could choose to go with Medicare Advantage, also known as Part C, Medicare Health Plans, Medicare Replacement Plans. They have a lot of different names. And those have the health, the Part A, Part B, and Part D together in one package, so you don't have to get a standalone drug plan. And we're going to talk about all this in more detail as we go along. So if you are already getting Medicare benefits when you turn 65, or I'm sorry, Social Security benefits when you turn 65, so maybe you took early retirement or you were on disability, but you hadn't been on disability for 2 years, or you were getting spousal support, then you're automatically going to be enrolled into Medicare because you're already in the Social Security system. If you're not collecting Social Security benefits, then you are going to have to actively enroll in Medicare through Social Security. So if you are receiving Social Security benefits or the railroad retirement benefits, then they're going to mail you an initial enrollment period package about 3 months before you turn 65. Or remember I said you could be on disability for 2 years and then you become eligible for Medicare. So the 25th month of disability, you would also get this package, and it includes your Medicare card and other information. If you automatically receive your Medicare card in the mail, you have to decide, do you want to keep Part A and Part B? If you do, you just keep the card and just go from there. There might be reasons why you don't want to accept Part B, which is the medical part of it, and we're going to talk about that a little further on. If you don't want to accept Part B, then you need to follow the instructions that come with your Medicare card, send that card back, and fill out the information that you don't want Part B, and then they'll send you a new Medicare card that just has Part A on it. So it's really important that your Medicare card reflects the exact coverage that you have. If you,
Mary Jane?
Yes.
I'm so sorry. I wanted to, I had a question come in. If you're not on Social Security yet, do you get the IEP package?
No, you do not. You have to be on Social Security. You have to be in their system.
Thank you.
To get the initial enrollment package. And if you lose your Medicare card, you can either establish an account on mymedicare.gov, or I think you can also do it on Social Security, mysocialsecurity.gov, or you can call Social Security and they can mail you another card. So there's several ways you can get another card if you do lose your card. So if you're not automatically enrolled in Medicare, then you will need to contact Social Security or one of those other agencies, Railroad Retirement Board, if you work for the railroad, or Office of Personnel Management if you're a federal retiree. You can enroll in Medicare by going on Social Security's website at socialsecurity.gov, or you can also access their website by ssa.gov. You can call Social Security, or if you're a railroad retiree, you would call the Railroad Retirement Board, or if you're a federal retiree, the Office of Personnel Management. So down at the bottom, there's a note down there, and it says the age for full Social Security retirement benefits is going up for people born in 1938 or later. Those born in 1960 and later will get full retirement benefits at 67. So what that's saying is, it used to be for everyone, your full retirement age in Medicare used to be 65. But it's not that way anymore. You age into Medicare at age 65, but your full retirement age is based on the year that you were born. So for example, I was born in 1955, so I aged into Medicare. I'm actually 65. I aged into Medicare this year, but my full retirement age is not until 66 and 2 months. So that means if I was going to collect Social Security benefits today, I would be collecting before my full retirement age, and therefore I would not get my full benefit, Social Security benefits. So I definitely want to wait until I reach 66 and 2 months before I collect my Social Security benefits. So if you don't already have Medicare, there are certain times that you can sign up for Medicare. So the initial enrollment period, when you age into Medicare, or when you become eligible for Medicare because of disability. And then if you don't sign up during your initial enrollment period, there is another general enrollment period that allows you to sign up for Medicare Part A or B, and that is January 1st through the end of March. And that allows you to sign up for A or B, but if you sign up during this period, your A or B will not start until July of in the same year, and you might have to pay a penalty for signing up when you are not eligible. And then there are other special enrollment periods that allow you to sign up for A or B, and we're going to talk about this in more detail. If you already have Medicare coverage, then there are times when you can make changes to your coverage. The one that we all know about is that yearly open enrollment period, which is October the 15th through December the 7th. And that is where you can look at the plan that you have, whether it be a drug plan or a Medicare Advantage plan. You want to review that plan and make sure it's going to be the best plan for you for the next year. Just because a plan was good for you this year doesn't mean it's going to be the best for you next year. These plans, they change their formularies, their deductibles, their copays. So you want to make sure that that's still going to be the best plan for you for the next year. And I'm really busy during Medicare open enrollment because that's one of the things I do, are drug plan comparisons and Medicare Advantage plan comparisons to see what, I compare your plan with the plan for 2021 just to see if there might be a better plan for you. And whatever changes you make during this open enrollment period become effective January 1. Also, there's a Medicare Advantage open enrollment period, and that's from January 1 till the end of March. To take advantage of the Medicare Advantage open enrollment period, you must be enrolled in a Medicare Advantage plan as of January 1. And this open enrollment period allows you to either drop the Medicare Advantage plan and go back to original Medicare and pick up a drug plan, or switch from one Medicare Advantage plan to another. Then there's another enrollment period called a 5-star enrollment period, and it allows anyone during the calendar year to switch from whatever plan they have to a 5-star plan. And Medicare rates these plans, and if any of them are 5-star, and sometimes we don't have any 5-star plans in our area, and I'm not for sure whether we do this year or not, I can't remember, but if we do, they're far and few between. I mean, there have been years that we don't have 5-star plans, but if there is one, they will allow a one-time change enrollment into a 5-star plan. And then, of course, special enrollment periods under circumstances. So when we talk about your initial enrollment period, it's a 7-month period. So it's 3 months before you turn 65, the month you turn 65, and 3 months after. So if you're turning 65, let's say in the month of August, then you can enroll in Medicare starting, let's see, that's July, June, and May. You can go on to Social Security's website, go on and set it up. Your Medicare is not going to start until the 1st of August, the month of your birthday, but you can get everything set up to where it all will start on the 1st of the month. If your birthday was August the 1st, then your Medicare would start July 1st. So if your birthday's on the 1st of the month, you will always start the month prior to that. And so you can get all your insurance and everything set up to where it'll start on the 1st day of the month of your birthday. But you also have 3 months after your birthday. So you have that 7-month period to enroll in Medicare and also get your insurance set up. The general enrollment period, that is when you didn't enroll in Medicare when you were eligible for it. So that's enrolling in Part A or Part B is what they're referring to, is that January through the end of March. And when you enroll in A or B, your coverage is not going to start until July the 1st. So you might have some late enrollment penalties, and those enrollment penalties will follow you for the rest of your life, unfortunately. And so if you enroll in Medicare during this general enrollment period, then whatever coverage you choose is not going to start until July the 1st. The Medicare Advantage open enrollment period, that coincides with the general enrollment period for A and B, but this is just for people that are on a Medicare Advantage plan as of January 1. So from January 1 to the middle of March, you can switch the plan from one Medicare Advantage plan to another, or you can drop the Medicare Advantage plan and return to original Medicare and pick up a Part D drug plan. Sorry, this at the top of the screen, it's got some information that the title of the slide that I can't read. There we go. Okay. So the yearly open enrollment period is October the 15th through December the 7th. And that is, again, when everybody reviews their plan and then they decide what if they want to change their plan, then you make the changes during that period and your changes become effective January 1. The Medicare special enrollment period, this is if you, let's say that you decided that you, okay, I'll give myself as an example. I turned 65 in February and I am working and I have employer coverage. And my employer coverage, my group health plan is credible coverage. So therefore, I chose only to enroll in Part A. Part A is premium free. I don't need Part B, and there is a premium for Part B. And the reason is I don't want to have to pay an extra premium because I have good insurance as it is right now. So I declined Part B. Once I retire, I have an 8-month special enrollment period to sign up for Part B. And so without having to pay the penalty. So you want to make sure that if you're working and you age into Medicare, you still want to check with your employer, with the benefits department, and make sure that it's okay that you stay on their insurance even though you're eligible for Medicare. Because some companies have different policies and they might say, no, you're eligible for Medicare. We want you to go with Medicare and we'll be secondary to that. So just make sure that you understand your insurance is credible coverage and that your company will allow you to stay on their group health coverage rather than going with Medicare Part A and B. I signed up for A because no premium, and it's just going to be secondary to my employer insurance. The 5-star enrollment period, we talked about that. If there is a plan that is rated as at 5 stars, then you have a one-time during the year that you can change into a 5-star plan. So other special enrollment periods, let's say you're in Texas and you move to Louisiana. Well, that allows you to enroll into another plan, whether it be a drug plan or a Medicare Advantage plan, because probably what's offered here in Texas will not be offered in Louisiana or whatever state you choose to move to. If you are on Medicare and Medicaid, then you have a special enrollment period that allows you to change your plan once every calendar quarter for the first 9 months each year. So every 3 months, you could change your plan if you wanted to, if you're on Medicare and Medicaid. If the plan that you're on leaves the Medicare program or reduces its service area, that would allow you a special enrollment period. If you're going into a nursing home or leaving a nursing home, that would allow you a special enrollment period. If you lose that extra help status, which is what we talked about, Medicaid, extra help is a government program that helps with your prescription drug coverage, and we'll talk about that a little bit later. So if you lose your extra help government program, then that allows you a special enrollment period. Or if you become eligible for it, that allows you a special enrollment period. If they make your Medicare entitlement retroactive, that would allow you a special enrollment period. If you leave or lose your employer or union coverage, that would allow you a special enrollment period. And then there might be other circumstances that would allow you a special enrollment period. So
Mary Jane?
Yes.
Excuse me. Sorry, we have another. I just don't want to go too far past the question because so the definition, they're asking for the definition of credible coverage that related to you're still employed and why you were declining.
Yes, credible coverage is, it has to be active employer insurance and it has to be as good as Medicare. So your HR department or benefits coordinator or whoever with your employer can tell you, yes, it's credible coverage. They could verify that it's credible coverage. And it just means as good as Medicare. Okay, so we'll just talk about Medicare A and B. So Part A is your hospitalization. It covers you inpatient when you're admitted to the hospital, covers the majority of things that are charged while you're in the hospital. And also your Part A services cover inpatient skilled nursing facility care. So that means if you go to rehab. So let's say you broke your hip and you have to go to the hospital and they replace your hip and you're in the hospital 3 nights and then they send you to rehab to learn to walk on your new hip. That would be your Part A coverage. But you have to spend a 3-night stay or midnight stay in the hospital for Medicare to cover rehab. And of course you have to have medical necessity for Medicare to cover the rehab. So these are just some things that Medicare covers, Part A, and there's some things that they don't cover. And we're going to kind of skip over some of these things in the slide just because there's so many slides and so much information. And we want to try to get through it in our hour time. So you can go through it, you know, see what it covers. What it doesn't cover is private duty nursing. It doesn't cover a private room unless it's medically necessary. So if you have something that they need to quarantine you for, then Medicare would cover it. If the television or phone in your room is not, like a separate charge on the hospital bill, then Medicare would not pay for that. And if you had anything charged like those personal care items, razors or slipper socks, those would not be covered by Medicare either. So most people don't pay a premium for Part A. They've worked their 10 years, they've paid their FICA taxes, and so you get your Part A premium free. If you don't have a sufficient work history, then you might have to pay a premium for Part A, and it varies depending on what your work history is. If you didn't sign up for Part A when you were eligible for it and you didn't have credible coverage, you might have to pay a penalty when you do sign up for Part A. And that premium is about 10% of whatever year that premium was, or 10% of the monthly premium for 2 years, twice the number of years you didn't have Part A and you were eligible for it. So this is if you had original Medicare and nothing else. this is what your cost would be. So for Part A, if you were admitted to the hospital, you have a deductible of $1,408. That will cover you the first 60 days you're in the hospital. Then if you're in the hospital over 60 days, you see you have some pretty hefty copays. If you go to skilled nursing facility, which remember that's rehab, Medicare covers that at 100% for the first 20 days. And then you have a copay of $176 per day for days 21 through 100. And if it's over 100 days, then you're responsible for all the costs. Part A also covers home health services and hospice services and blood. So that deductible that we talked about, that $1,408 deductible, that's per benefit period. So a benefit period is, let's say you go into the hospital and maybe you go to rehab and then you go home and you are out of the hospital for 60 days and then you go back in the hospital on day 61, you are in a new benefit period and you would have to pay that deductible again. But let's say you went in the hospital, maybe you went to rehab, and you were out for a couple of weeks, and then you went back in the hospital, there's not that 60-day lag in between discharge and readmission, so you're in the same benefit period and you would not have to pay that deductible again. So that benefit period is not per calendar year. There's no limit to the benefit periods you can have, and they span over, they're not just from January to December. So again, Part A is premium free for most people. If you don't have a work history, then you're going to have to pay for your Medicare Part A. And if you, it says at the bottom, note, to avoid internal revenue tax penalties, stop contributions to your health savings account before Medicare starts. So if you are working and you are contributing to a health savings account, you do not want to even apply for Medicare Part A because there's a penalty if you're on a health savings account and then you're contributing or you're signed up for Medicare, there's an IRS penalty that you have to pay. And I'm not for sure, I think it's 8% for all the contributions that you make to the HSA while you're signed up for Medicare. So if you, let's say you're working, you didn't sign up for Part A, but you're 67 and you say, well, I might as well sign up for Part A, might as well, there's no charge for it. Well, if you're contributing to a health savings account, make sure that you quit contributing to that health savings account 6 months prior to when you sign up for Medicare. Because let's say you're 67, you would have qualified for Medicare at 65 because many times Social Security will make your Part A retroactive back 6 months. And so that would coincide with you contributing to the health savings account. So that's why I say that if you were Medicare eligible within 6 months prior, then you'd want to make sure that you wait 6 months and not contribute to your health savings account. Part B, your doctor's visits, outpatient services, MRIs, x-rays, durable medical equipment, diabetic testing supplies, most of your preventive services. Part B also covers home health care and also covers like physical therapy, occupational therapy, speech therapy, and also outpatient mental health services. So for Part B, there is a premium, and the standard premium for 2020 is $144.60. If you're higher income, you might have to pay a higher amount, and we're going to look at that on the next slide. And some people who are getting Social Security benefits now, they might be paying a little bit less than $144.60. I won't get into the reason why, but there might be some folks that aren't paying quite $144.60. So here shows if you are a higher income. So if we'll look at the second line there, if as an individual, if your income is above $87,000, then you're going to be paying a higher Part B premium. So a regular person would be $144.60, and if you're above 80,000 as an individual, it would be $202.40. If you're above 174,000 as a couple, then you would each pay $202.40. And then it kind of goes down from there, shows you higher income and what you would pay as your Medicare Part B premium. That is called the Income Related Monthly Adjustment Amount, or the IRMAA. And that's kind of up at the top there.
Mary Jane,
Yes.
can you answer what is used to determine income level?
It is, I think, your adjusted gross income, and they go from your prior, that's a good question, I should have mentioned this. So for 2020, they would look at your 2018 tax return, and I think it's the adjusted gross income. So if you're not working anymore, there is a way you can appeal this, and there's paperwork that you would fill out, a form through Social Security, and you would appeal, say, I'm not working anymore, I'm not making that amount in 2020, and so you could maybe be charged just the regular premium.
Thank you.
The yearly deductible for Medicare Part B is $198. And so again, these are your costs if you have original Medicare and nothing else. So once you satisfy the $198 out of your pocket, then it's 80-20. Medicare pays 80% and you pay 20%. So some of the preventative services, you do have a $0 copay, but most things are going to be your 20%. So if you do not have employer coverage from a group health plan, if you decide not to sign up for Part B, you will be possibly penalized for that. And you can only sign up during that general enrollment period, which is January the 1st through March the 31st. And your coverage will not start until July the 1st. So I know some people are collecting Social Security benefits, and then they become eligible for Medicare. Maybe they took early retirement, they become eligible for Medicare, and they don't feel like they can afford the $144.60 being deducted from their Social Security benefits. That is a really scary thing to do, because now you don't have any coverage with the doctors. And now when you do want to sign up for Part B, you can only do it between January 1st and March 31st, and your Part B will not start until July 1st, and you're going to have to pay the penalty. So there are government programs that I do a lot of outreach work with that will help pay that Part B premium, and we're going to talk about that at the end of the PowerPoint. So, you know, it's always good to speak with somebody. Don't make that decision on your own, and we can screen you and see if you qualify for the Medicare Savings Program. If you do have coverage through a group health plan, then you might want to delay signing up for Part B, which is what I did. My group health coverage was credible coverage. And so then when I retire, then I have 8 months special enrollment period to sign up for Part B. And there's some paperwork that I will have to get my work to fill out to document that I've had credible coverage all this time. And then when I present that to Social Security, I will not be charged the penalty. So for Part B, most people, you know, you're just going to have to look at your own situation. Are you working? You know, there is a premium for Part B. If you want to sign up for Part B and you have credible coverage, that's fine. But your Medicare is going to be secondary to your group health insurance. So if you've got pretty good insurance, no reason you want to pay the $144.60 if you've already got pretty good insurance. But it would be secondary to your employer insurance if you decided to go on and take A and B and you're still working. So if you want to buy a Medicare supplement or Medigap insurance, you must have Part A and B. If you want to join a Medicare Advantage plan, you must have Part A and B. If you're eligible for TRICARE for Life, you must have Part A and B, or CHAMP VA. Or if you're working for an employer and they have less than 20 employees, then you must sign up for Medicare. And Medicare would be primary, and then your employer insurance would be secondary. Down there at the bottom, the note, this is really important. So maybe you're a veteran and you get your, you go to the VA hospital and get your, you know, care there at the VA hospital. A lot of people will not sign up for Part B because they don't want to pay the premium for Part B, and they just want to access the VA hospital. But then they realize it's too hard to drive down to Dallas or to drive to Bonham for VA services. And this is exactly what happened with my dad. We lived in McKinney, and he was driving to Bonham, but it got to where he just couldn't do that on his own. So luckily he had Medicare Part A and B, and he could access his Medicare doctors in McKinney. So if you're using the Veterans Affairs benefits and you don't sign up for Part B, but then in the future you decide that you want it because you can't access the other hospitals, then you will pay that penalty because veteran coverage is not considered credible coverage. So just beware of that if you are a veteran. So these are things that aren't covered by Part A and B: dental care, eye exams related to prescribing glasses. So Medicare will cover an eye exam every year, but they don't cover the refractory part, the part that says is A better, or is 1 better, or 2 better, 2 better, or 3 better. That's the one part they don't cover. They don't cover dentures, cosmetic surgery, routine physical exams, massage therapy, acupuncture, hearing aids, or the exams for fitting them, long-term care services, or concierge care. So that's those boutique doctors or concierge doctors. Those are kind of popping up a lot now. So the Medigap policy is also known as a supplement. So those words are interchangeable, either Medigap or supplement. They're to come in and supplement what Medicare does not pay. So we just talked about Medicare, and Medicare doesn't cover everything. So depending on which Medigap policy you choose depends on what your coverage is. So just think of it, it fills in the gaps or supplements what Medicare does not pay. So the Medigaps are designated by letters, A, B, C, D, F, G, K, L, M, N. They did away with a couple of years ago. And if you choose a Plan G, a Plan G is a Plan G is Plan G. It doesn't matter who you get it with. It is the same exact coverage, and that coverage is regulated by the Department of Insurance. So Plan F is top of the line Cadillac coverage. But as of January 1, 2020, people becoming eligible for Medicare after January 1 will not be able to sign up for a Plan F or a Plan C. But there is a Plan G, as in girl, and that's almost as good as an F. The only thing Plan G doesn't cover is your Medicare Part B deductible. And the only thing that is $198 for 2020. So once you pay the $198 out of your pocket, then the Plan G will come in and pay all the other costs, just like Plan F. There are other plans where there's a little more cost sharing. Your premium would be less. Plan N is a pretty popular plan, a little more cost sharing with that, but Plan F and Plan G, Plan G and Plan N are probably the two most popular plans. Now, if you became eligible for Medicare before January 1st, 2020, then you could sign up for a Plan F or a Plan C. And that's just talking about just what we talked about. All right, so the best time to sign up for a Medigap policy is when you first enroll in Medicare or when your Part B starts. So take for example myself. I signed up for Part A, I don't have Part B. When I retire, then I'm going to sign up for Part B. And I have 6 months. It all pivots on when my Part B starts. I have 6-month guarantee issue with the Medigaps. They cannot turn me down for any pre-existing conditions for that first 6 months. But let's say I went with the Medicare Advantage plan for a couple of years, and then I wanted to go back to original Medicare and pick up a Medigap policy. I could do that, but now I have to undergo medical underwriting, and that Medigap could turn me down for pre-existing conditions. So your best time to get a Medigap is when you first sign on to Medicare Part B. Okay, I can give you estimate prices. I have a comparison tool. I think on the Medicare.gov, they also have a Medigap comparison tool that will kind of give you prices, but it's only estimated. You really need to talk to an insurance person to get your exact price because there's so many things that go into determining what your monthly premium are. So or what your monthly premium is. It's, you know, your zip code, if you're male or female, if you're smoker or non-smoker, if a husband and wife get a plan together, you get a discount. So there's a lot of things that determine what your monthly premium is. This says contact your state health insurance assistance program, or SHIP. That's what I am, a SHIP benefits counselor. And again, I can give you estimates, but you're going to have to enroll through an insurance person to be able to find out your exact monthly premium. So Medicare drug coverage, it's available to all people who sign on for Medicare. You do have to sign up for a drug plan. It doesn't just come automatically. And that's one thing I can help with. I do drug plan comparisons and help people choose a drug plan. So you can get your drug coverage a couple of different ways. If you stay with the original Medicare and get a Medigap policy, then you would get your Medicare drug coverage just through a standalone plan. You can also get your drug coverage by joining a Medicare Advantage plan, because remember, that has the health and the drug coverage embedded together in one package. So there's a couple of different ways you can get your drug coverage. And then through some other Medicare health plans. We don't have some, though there are cost savings plans and some other plans, Medicare savings plans, but we don't have them in this area. So your drug plan is going to vary in cost. The premiums might be different. So you're going to pay a premium. The plan might or might not have a deductible. You're going to have co-payments or co-insurances. And if you've ever heard of the donut hole, they did away with the donut hole in 2019, but now they have the coverage gap. So one way or another, they're going to get you. The coverage gap is once the retail cost of your drugs reaches $4,020, then you might pay a little higher copay for your medications. So let's say you go to the pharmacy and you pay a $25 copay for your medication, but the retail cost is $100. It's that retail cost that's adding up in the background, and once the retail cost adds up to $4,020 for 2020, then you would go in the coverage gap, and there's a possibility you might pay a higher copay for your medications. Then you have to reach a $6,350 out of pocket to put you into catastrophic coverage, and that would reduce your copays for your medications. So there is a IRMAA, or monthly income related monthly adjustment amount, also for your Part D plan. So if you're higher income, you're going to pay a little bit more for your premium for your Medicare Part D. And so this shows you if you're over 87,000 as an individual, or 174,000 as a couple, you would pay your plan premium. That's what YPP stands for, plus a $12.20 each month with the monthly premium. And then it kind of goes up from there. So Part D is optional. I always suggest that people do get a Part D drug plan, even if they're not taking any medications, because you might have to pay a penalty if you didn't join one and you were eligible for one. So if you're only taking a couple of generic drugs that aren't very expensive, or not taking any medications at all, we can find, there's some plans out there that are only like $16 a month. So I would always suggest going with maybe one of those, just so you won't be subject to the penalty later on if you needed a plan. So all the plans have formularies. That's the list of drugs that they cover. They're required to cover a range of drugs in each category. Sometimes they are subject to change. So maybe if there is a drug that's pulled by the FDA, they will let you know they can't offer that at that time. Or maybe if there is a brand name and there's a generic that comes out, you'll be notified that, you know, of the generic availability. And then if you're using a drug plan, each of these drug plans have network pharmacies and preferred pharmacies. So you can usually get a better price if you use a preferred pharmacy with that plan. And that's something that we can find out when we do a drug plan comparison for you. And then there are, we talked about the government program Extra Help. That's a government program to help with your Part D drug cost if you have limited income and resources. And so to join a drug plan, you only have to have Part A or Part B. You don't have to have both. But if you join a Medicare Advantage plan with drug coverage, you do have to have Part A and Part B. You must live in the plan service area. You can't be incarcerated to have a drug plan. You can't be unlawfully present in the United States, or you can't live outside the United States to get a drug plan. And of course, we talked about you have to actually physically join a drug plan to get the drug coverage. It doesn't just come automatically. If you don't enroll in a drug plan when you were eligible, this is talking about the penalty. One exception would be if, like myself, I have employer drug coverage. My drug coverage is credible coverage. Therefore, when I do sign up for Medicare Part B as in boy, and then I sign up for whatever Medicare Advantage plan or Medigap, then I'm not going to have to pay that penalty because I've had credible coverage all this time until I went with Medicare all the way. Or if you qualify for extra help, you would not have to pay the penalty. And that penalty for not signing up for a drug plan is 1% for each full month you were eligible for a drug plan and you didn't have credible coverage, prescription drug coverage. And so they take the 1% by the base beneficiary premium. So the base beneficiary premium for 2020 is $32.74. So 1% of that would be 32 or 33 cents. So, it's not a huge penalty. Even if you went for a year, it would only be 33 cents a month for times 12. But if you went several years without a drug plan and with several years of penalty, it might amount to something, and that would follow you the rest of your life. So again, you want to make sure that all your prescriptions are covered on the plan's formulary. You want to make sure that you're using a preferred pharmacy if at all possible. And you might have to pay the penalty if you don't choose a drug plan when you don't have credible coverage. Once I retire, I'm going to have 63 days to sign up for a drug plan. So I know when I retire, I'm going to go on and already have my Part B to start. Let's say I want to retire in November. I'm going to have everything set up to where my Part B is going to start in November, and my other coverage, whether it's a Medicare Advantage plan or a Medigap and a standalone drug plan, is going to start November 1st too. So I can do that. I can arrange it to where so it'll be seamless. My employer coverage will end and my Medicare coverage will begin. And okay, you can enroll in a Medicare Part D drug plan during that initial enrollment period, during open enrollment, which is October the 15th through December the 7th, or during that general enrollment period. So and that's for A and B. So when you sign up during the general enrollment period for A and B, remember it's January to the end of March, your coverage doesn't start until July 1st and your A or B. And so that's when you can sign up for your drug coverage. And then there might be other times that you can sign up for drug coverage. So in that Medicare Advantage open enrollment period from January 1st to March the 31st, you have to be enrolled in a Medicare Advantage plan as of January 1st, but you could drop your coverage and go back to your original Medicare and pick up a drug plan. And then there's other special enrollments periods that you might be able to sign up for a drug plan, or the 5-star enrollment period, the special enrollment period that we talked about. So that you can, Medicare.gov has a great website. You can do plan comparisons yourself on the Medicare Plan Finder, or Medicare can do that for you, or you can contact your SHIP for helping you to compare plans, and that is myself. I'm a SHIP benefits counselor, so I can do that for you too. And then to enroll in a plan, Medicare can enroll you in the plan. I can enroll you in the plan on Medicare's website. You can call the plan, you can do a paper enrollment. There's just several ways that you can join the drug plan. We're just going to kind of skip over that because we've talked about all of this. Okay, so let's talk about Medicare Advantage. So the Medicare Advantage plans, remember, are the health and the drug plan embedded together in one package. So you're still getting your Medicare coverage, but you're getting it in a different way. So if you join a Medicare Advantage plan and you go to the doctor, you show them your Medicare Advantage plan card. They might want to see your Medicare card, but if they bill Medicare, Medicare is going to decline it because you're in a replacement plan. So they're covering, that Medicare Advantage plan is covering your health coverage and your drug coverage. So the Medicare Advantage plans, they are run by private companies, but they're approved by Medicare to provide these benefits for the Medicare beneficiaries. So they are a part of the Medicare program. There might or might not be a premium for the Medicare Advantage plan. You pay copays when you access the Medicare Advantage plans, and also Medicare pays these Medicare Advantage plans a certain dollar amount to manage each Medicare beneficiary. So if you join a Medicare Advantage plan, the $144.60 that you're paying for your Medicare Part B premium, instead of that being paid to Medicare, that's paid to the Medicare Advantage plan. So that's how some of these plans can provide the coverage for you at zero monthly premium. So it's really not zero monthly premium, you're paying $144.60, but all of that happens in the background. Now, some plans might charge you a little bit more for the monthly premium, or some might have a zero monthly premium. And your copays vary from plan to plan. So you want to make sure that you understand what all your copays are when you join that plan. So they're usually going to be HMOs or PPOs. HMO, you know, you have to you stay in the network. You cannot go outside the network or they will not pay. You have to get a referral from your primary care physician to see a specialist. PPO, you have a little more freedom. You can go outside the network. They won't pay as much, but they will pay some. And you don't have to get a referral from your primary care physician to go to a specialist. Your PPO plans tend to be a little bit more expensive, and your copays are a little bit more with the PPO plans. So the Medicare Advantage plans, you're still associated with Medicare. You have all the rights and protections that you do with Medicare. You still get all the services covered by Medicare Part A and B. It's just that your Medicare Advantage plan is covering those services. You're still going to get your prescription drug coverage. You may be charged different out-of-pocket cost in a Medicare Advantage plan than original Medicare, but you cannot be charged more than original Medicare for certain services like chemotherapy, dialysis, or skilled nursing facility care, which is rehab. Some of these Medicare Advantage plans have additional coverage like vision, dental, fitness, or wellness benefits. So, you know, that's something that Medicare doesn't cover, but just make sure that you understand what those benefits are before you join the plan, because it might be dental. It only covers cleanings and x-rays a couple of times a year. Some of them have optional packages you can purchase at an additional monthly premium, but that would give you expanded benefits. But that's just something that you need to investigate before you join the plan of what their optional or extra benefits are. So the Medicare Advantage plan has certain areas, they're very zip code specific. So if you were in a Medicare Advantage plan down in Houston and you moved to Dallas or the Dallas area, you might have to choose another Medicare Advantage plan. It might not be offered in this area. And that would give you a special enrollment period because you've moved out of your service area. And so each plan has different rules how you access services as far as maybe some of the extra services, and those rules can change every year. If you are on a Medicare Advantage plan and you are and you're put on hospice, then original Medicare does cover hospice in that situation. So in 2019, Medicare and Medicaid expanded the definition of primary health related to consider an item or service as primarily health related if it is used to diagnose, compensate for physical impairments, improve functional or psychological impact of injuries or health conditions, or reduce avoidable emergency and healthcare use. So these benefits must focus on the enrollee's healthcare needs and be recommended by a licensed medical professional as part of a care plan, if not provided by one. So they were allowing these Medicare Advantage plans to offer expanded services. So there were about 160 plans that were in providing the Medicare beneficiary with some of these expanded services, and this was in 2019. So some of the services were adult daycare services, home-based palliative care, in-home support services, support for caregivers and enrollees, and therapeutic massage. And so you can see Texas was one of the states that was allowing those expanded benefits, but it was up to the Medicare Advantage plans if they were going to offer it and if you were eligible for it. So just because you were in that plan doesn't mean you were eligible for the expanded benefits. So here's just a little, mentioned some of the same benefits, but a little bit expanded list. So adult health services, adult day health services, home-based palliative care, in-home support services, support for caregivers of enrollees, medically approved non-opioid pain management, standalone memory fitness benefit, home and bathroom safety devices and modifications, non-emergency transportation, and over-the-counter benefits. So those are some of the expanded benefits in 2019 that Medicare allowed the Medicare Advantage plans to offer. So in 2020, they also allowed these Medicare Advantage plans to offer non-primarily health-related items or services. And so these are, and this is just for the chronically ill. So these are some of the services that they were allowing Medicare Advantage plans to offer. So home-delivered meals, food and produce, transportation for non-medical needs, pest control, indoor air quality equipment and services, social needs benefits, complementary therapies, services supporting self-direction, structural home modifications, and general supports for living. But again, it has to be for the chronically ill, and the Medicare Advantage plans were the ones that could decide which beneficiary would qualify for those services. So just because you joined that plan that offered those services doesn't necessarily mean you would qualify for them. So Medicare Advantage plan, you can join one during your initial enrollment period, during the open enrollment period. You can switch from one Medicare Advantage plan to another during the Medicare Advantage open enrollment period, which is January through the end of March. And if you switch, like if you move out of the service area, then that would give you a special enrollment period. Or if there was a 5-star plan in your area, you could make a switch one time in calendar year to a 5-star plan. Okay, I can see we're kind of getting toward the 1 hour mark, so I might skip over some of these slides just because I want to talk about, we talked about you must have Part A and B to join a Medicare Advantage plan. Most of them have drug coverage. You cannot have a Medigap and a Medicare Advantage plan. You go one way or the other. And Medicare Advantage plans are not known as supplements. They are Medicare Advantage plans, Medicare replacement plans, Medicare health plans, or Part C. That's what Medicare Advantage plans are known as. So these are programs that I do a lot of outreach for, and these are people that have limited income and resources. So the Medicare Savings Program, that will pay your Medicare Part B premium, that $144.60. There's 3 different levels of that program, and it also could pay for your Medicare premiums, deductibles, and coinsurance. Extra Help we talked about, that's that government program that will help with your prescription drug cost. And then Medicaid. Medicaid is it's a federal and a state program. It's a state program, but it also gets federal funding. And so Medicaid would be something that I could help you see if you qualify for. Okay, so here's the Medicare Savings Program, the 3 different levels. QMB, SLMB, and QI. I'm not going to go over the QDWI. I very rarely run into that. In fact, I never have run into that in the 10 years I've been a benefits counselor. But the QMB, you would get the richest benefits, and your income can be no more than $1,083, and that's gross before they take out anything out of your Social Security benefits. Or we also count earned income, but if you're over 65, they only count half of your earned income. And the QMB, you would get a Medicaid card. It's going to pay your Medicare Part A and B premiums, or you might have a sufficient work history. You don't need it to need to have it pay your Part A premium, but it would pay all the deductibles, co-insurances, and co-payments. So that hospital deductible, if you're in rehab over 20 days, your 20% that Medicare doesn't pay on your Part B services, that's what the QMB would pay. The specified low-income Medicare beneficiary in the QI, you can see your income can be a little bit higher as an individual. This is just for the couple. Those are your income limits for the couples. That doesn't pay all the costs that Medicare does not pay, but at least it will pay your Medicare Part B premium. So for 2020, that's $104.60. So that might give a low-income senior more money to pay their rent or medications or their utilities. So it still could be very helpful. And Extra Help is the program that will help pay your prescription drug coverage. And if you didn't join a drug plan when you were eligible, and now you need a drug plan and it's not Medicare open enrollment, I can screen you for this plan. And if you qualify for it, then we'll help you apply for it. And once you're awarded the Extra Help, then you can sign up for a drug plan outside of Medicare open enrollment and you won't be charged the penalty. So qualifying for Extra Help, you automatically would qualify for the Extra Help if you had full Medicaid coverage. Supplemental security income would be full Medicaid coverage if you were on SSI. Or if you were on the Medicare Savings Program to help pay your Medicare premiums, then you would automatically, after that came in to your eligibility, then you also would qualify for Extra Help. Otherwise, if you're not on those programs, then you would have to apply for Extra Help, and I can help somebody do it on the Social Security website. It's real easy, probably one of the easiest government programs there is to apply for. Okay. Medicaid, it's a joint federal and state program. It's basically a state program with federal funding. It helps people with healthcare costs that are of limited income and resources. You can be Medicare and Medicaid. You can be dual eligible. And Medicare does not cover nursing home care or personal care or home and community-based services, but Medicaid does. So there's nursing home Medicaid that can help cover if you are nursing home eligible and you don't have the money to pay for it, then we can screen you for nursing home Medicaid and that can pay for your nursing home care. Qualifying for Medicaid, it varies from state to state. So you want to make sure that you understand when you, let's say you're living in New York or California, and then you've got Medicaid in those states and you move to Texas, it's a whole different ballgame. You have to cancel your Medicaid from the state you moved from and reapply in Texas. And I will tell you, Texas is on low man on the totem pole when it comes to social services. So I have plenty of people that say, well, in California I got, or New York I got. Well, in Texas, you probably won't get that. It's a lot different. So, and the income asset limits might be different for all the Medicaid programs also from state to state. Here's just giving you some helpful websites. This is just some acronyms that are included in the PowerPoint. And that's my information and my email and contact phone number. So I'm going to kind of leave that up on the screen if we have any more questions. If you want to contact me, please feel free. If you don't want to ask a question now, you can call me or email me, and then we can talk privately on the phone. I'm working from my home, like most people are now. So I'll open it up for questions. Kristen, if anybody has any questions.
Thank you, Mary Jane. And I want to remind everyone that you can go ahead and ask any questions that you have in the chat. I do have one question for you now. And then if anyone else has a question and they'd like to type it into chat, or we can also ask you to raise your hand and we can unmute you if need be. So the question is, what about coverage for women's wellness? And for screening exams such as colonoscopy, mammography, that sort of thing, is that covered by Part B, or how would someone get those coverages?
And it is covered by Part B. There's certain criteria for each one of those preventative or wellness benefits. And actually, there's a little booklet on Medicare's website, medicare.gov, and I forget what the name of the booklet is, but you can If you're computer savvy, you can look and see, like the colonoscopy, I think you have to be at risk or high risk or a certain age, or, there's different things. But if you meet that criteria, then there's no cost for many of the preventative benefits. Yes, Medicare does cover them. I hope that answers your question.
Thank you. Yeah. And then can you repeat a summary of the services you offer?
So I'm a benefits counselor, so I help with any questions on Medicare and Medicaid. I deal mainly with people that are 60 and above or under 60 and on disability and Medicare. So I can help you with Medicaid for people that are on Medicare, or any kind of senior question, really, that's if you're 60 and above. I have a lot of resources. I mean, my specialty is Medicare, and that's what I'm going to know most about. My specialty is not Social Security, but I can answer some Social Security questions. But, I can help you, and if I don't know the answer, I might know somebody that does. So feel free to give me a call, and I can say, well, I don't know that, but you need to call such and such, and they might be able to help you with that. So, but my main thing here.
And if someone on our program today, someone viewing, has a relative or someone that they need to find out from a different county than you cover here, you've listed all the counties that you cover, but outside of that realm, if there's another county in Texas, is there a listing of benefits counselors or somehow that they could find a person for the county they need?
If you want to call me or email me and tell me what county they live in and what state, then I can do some research and find the area agency on aging that covers that county, and then you can call that agency. If you're computer savvy and you Google area agency on aging and then put Collin County, Texas, it'll pull up the area agency on aging that services that county. So it's all tied into the county that they live in, not the zip code, not the city. It's the county. That's how the area agencies on aging are divided up by county.
Great. Thank you, Mary Jane. Are there any other questions? I don't see any other questions yet in the chat unless I've missed something and one of my colleagues can jump in. That's all the questions that I have seen so far. Anyone else have a question for Mary Jane? I have just a couple of quick things I was going to mention if I don't see any other questions from Plano Public Library, other programs that are coming up that may be of interest to you. I know the presentation has run a little over an hour. If you need to leave, we certainly understand. If you have another moment to see, we have just a couple of things. I was going to give you some information here. Let me get you that. Okay, so just giving you a little bit of information about services that are provided through the library currently. The library is more than books. We have skill building programs for you. Lynda.com, if you have a Plano library card, you have access to over 6,000 different courses and certifications on business, technology, and other skills. So even technology that you might be interested in using for fun. So we have these technology courses offered at no cost through lynda.com. We also have the great courses available to you online at no cost through Canopy or RB Digital. There are courses, these are video courses professionally done on a variety of topics, and I've just listed a few of them here for you, but there's even like yoga or meditation, that sort of thing, cooking and gardening sorts of classes, lots and lots of things that you can learn through these programs, again, at no cost with your library card. We also have a number of programs that are personal development sorts of topics that are done like this, like Mary Jane's been presenting to you on Zoom. Those are free and open to the public. You just register, and they are listed on the Plano Library website and also City of Plano virtual calendar. And the services that are available to you right now at the library, although we are closed for general use to the public, we have a variety of ebooks, e-magazines, video streaming, all kinds of things available to you online. You also can place materials on hold, physical books and materials. We have learning backpacks and those sorts of things that are available for porch side pickup, meaning that you drive up to the library and call when your item is available, when you've been notified that your material that you've held is available. Then you can come to the library, you call us from your car and say, I'm here. The staff will pull your items off of the shelf and put them on a cart outside. They'll check them out for you, put them on a cart outside the front door, and then they will return to the library and you can go, no contact, just grab your items and get back in your car and leave. So that's a service that's available for you. You also can make an appointment for computer and internet access. You can book that 2-hour appointment one day in advance, and those appointments are available at all 5 of our locations. We also do have the Book a Librarian service, which is one-on-one help with the librarian. That is a 30-minute appointment that you can make those again in advance, and that's a virtual appointment, so they can help you online over the phone. Upcoming classes, this is, I think, is of interest for you. We have an ongoing book club called Cook the Book, that's about cooking. We're using cookbooks, and at this point it's going a little differently. This is an online cooking program, but that might be of interest to you. We also have a Connecting Seniors regular conversations that are available. The one that this month is, the theme is Meals and Memories, and Mary Jane will be back with us to present Senior Medicare Patrol September the 10th. And then we also have a fraud program through the AARP September the 18th. So we welcome you to any of these programs. We also have past programs available on video, and we are so glad that you are with us today. Thank you so much for being with us, and we look forward to your next visit with Plano Public Library.